This is my Uncle Richard. He's 67 years old, painter and decorator by trade. Around two or so years ago.
About 2.5, 3 years ago.
Yeah, he started getting some symptoms where he started feeling
numbness in my finger and thumb, and it got progressively got worse and worse going up my arm, and I couldn't hold nothing in my hand.
he was off balance, wasn't he?
My balance was unstable.
Couldn't walk on shiny surfaces.
My eyesight
in the dark.
wasn't that perfect because it affected my eyesight as well, and
eventually then you needed assistance, didn't you, to kind of just walk?
Yeah, walk across like shiny surfaces and that, and then
went to the GP.
I went to my local GP after a lot of prompting from the family.
Eventually you got into the GP.
And the GP referred me to a specialist.
You had an MRi scan.
Then she referred me to the MRi scan, which is shown on the screen.
Compression of the spinal cord.
Yeah.
And referred to the specialist hospital then.
I went to Tewkesbury Hospital to see a surgeon, and he recommended I should have the surgery. I could have had it done on NHS, but there was a long waiting list, and they couldn't answer my questions, how long I had before I went paralysed, or they couldn't answer it because it was an impossible question to answer. And
yeah, that's when we researched Dr Ranganathan.
Yeah, so we went online and researched surgeons, the best surgeon in the UK, and we come up with Dr Ranganathan, and we made an appointment to come and see him. And he see me, and he said roughly the same words as the other surgeon, but he explained it more better in a professional manner, and said I needed the surgery. Not, it's up to you whether you have it or not. You really need it, whether you have it here or you go on NHS, but that's entirely up to you. But my advice is you need the surgery.
Yeah, whichever way. He said that basically, you know, you're going to be ended up
paralysed in a wheelchair.
Regardless. So you needed the surgery to prevent that from happening.
But I wasn't too happy about the surgery because
you were
I was
scared.
Petrified, not scared. But he reassured me.
We were all scared.
He really reassured me. He said it'll go well, but there is side effects. It could be risk then. Sorry, not side effects. Yeah. I could end up paralysed anyway through the surgery,
or blind,
or blindness. But he said 90% sure the surgery would be going okay, and well, I'm glad I had it now. To tell you the truth.
Well, it was eventually you were eventually going to be paralysed if you didn't have the surgery. So we decided we just had to do it. It was so important to.
Yes, it was, and it's the best thing I ever done actually in my life. That though I was petrified.
And now here we are, 3 months later, after your surgery.
I got feeling back in my hand.
You can do your buttons up.
Yeah, do my buttons up. I'll be coming back properly, and I can walk a lot better. My balance is A-okay, and my eyesight's getting better as well. And I'm really pleased I had the surgery. And I can't thank Dr Ranganathan enough. Ranganathan, sorry, for getting his name wrong again. But enough for coming to the surgery on me. And I'm pleased as punch with it.